Good afternoon. Hi, everybody. I'm Dr. Josh.
Hi, I'm Dr. Kristina.
And welcome to Crossroads Chiropractic Facebook Live. And today we got some good stuff for you.
Yeah.
Actually, it's one simple good thing for you.
One very simple, easy thing to do.
So, one of the hardest things as a chiropractor is we have to learn, right? We're always learning.
Yes.
Right? We have to do continuing education. Well, guess who did a neurology seminar this weekend?
This guy.
Guess who's going to give you a good neurology exercise today? So Dr. Kristina is going to be my demonstratee. So we're going to do it together. we're going to do it together so that you can, you get two people showing you how to do it. So you have no excuse. So this exercise is really super simple. It's ridiculously easy.
Very, very easy.
Anybody can do it. And what it does is it stimulates your brain, so it gets the left, right, and the brain firing. Yeah. It gives you that cross-crawl pattern type of mechanism, which we should be doing. So when you're stimulating the left side of the brain, right side of the brain, you can do it at any pace, that you feel comfortable. It's not a race. And you only need to do it for 1 minute, 3 times a day.
That's very simple.
What is this exercise?
But technically, people should be getting up and moving every hour.
Absolutely. That's true. Exactly. So this is on top of getting up every hour, right?
Exactly. So, if you want to do this every hour.
If you want to do it every hour, this would be fantastic. Absolutely.
It might not be a bad thing, right?
Yeah, absolutely. So, so you only need to do, it would be a good thing,
There
actually.
you go. And then you just get extra added bonus.
Exactly.
But yes, I can demonstrate.
So, are you anxious to find out what it is? All right, I know you are. So, what you're going to do basically is you're going to do this. You're going to, wait a minute. You're going to march in place.
Feel a little goofy,
You're going to feel a little weird.
You're
going to march in place.
It's like, the old aerobics. Did anybody out there do Jane Fonda like I did? I know. Dating myself, maybe.
I've never done that.
You've never done Jane Fonda? Come on, it's awesome. You just gotta march in place because you gotta warm up.
March in place. So the reason why we're doing this is we want to get that cross-crawl pattern. So left hand, right foot, right arm, left knee, right? And you want to get your leg up as high as you can, right? Now, for a lot of our patients who have artificial hips, artificial knees, be very careful. Yeah. I don't want you to be jerking your leg up high, right? You're going to want to be just almost like a walking kind of pattern. Just go as high as you can. If you have to hold on to your walker, and do the knees, that's okay. That's something. Yeah. You're still getting that left-right brain. It's better to do the arms too as well.
Yes. But you work up to that.
But you can work up to that, exactly, right? I don't want you to put yourself in an uncomfortable position or where you're going to hurt yourself.
Yeah.
We don't want that.
No.
We don't want that.
We don't want that.
So
works the brain, works the cardiovascular system.
Works the cardiovascular system because the harder you go, the more work you're going to do. Your breath starts to be more rapid. Right. Like I even noticed myself just doing it for a few seconds. And it also is fantastic for the muscle because what ends up happening is you're sitting for so long. Yeah. So your muscles in the front of your shoulders are tightening, your hamstrings are tightening, your hip flexors are tightening, which we talked about in the last video. And so this is kind of counteracting those things and trying to force the muscle so we're actually getting an active stretch and contraction.
Yeah, that's it.
Brilliant.
Gets great blood flow to the areas and helps warm everything up. Okay, that's
you don't have to look like that.
Weird.
That reminds me like the lollipop kids. You represent the lollipop kids.
Okay, that's way before my time.
All right. That's from, if you know what it is from movie, put it in the comments. Put it in the comments below.
Because I have no idea.
The lollipop kids.
Okay.
No
idea.
See, they look just like that on the movie. Anyways, The Wizard of Oz. Yeah, there you go. So start that 3 times a day for 1 minute at least. That's a good way to start, right? Yeah. And again, do it as hard as you want, as easy as you want, but just get up and moving. Yeah. But again, like Dr. Kristina mentioned,
what did I say?
Every hour you should be getting up and moving. Because even though you're stuck in the house and you're social distancing and you got to be separated from people, even though you're physically separated, right? We want to socially be connected. And so that's why we're doing this video.
That's it.
Awesome.
Yay.
And you need to keep moving.
Exactly.
Brilliant.
Awesome. I think we're good.
We're good. So if you like this video, please share it. Send it to your friends, your family members. Yeah. Start telling your people that you know to start get moving. Yeah. Start getting them walking. And even share this idea to your friends and your neighbors, right? Because it's something so simple. If you have family that are you haven't seen, but if they can physically do this, tell them, your parents.
Yeah, if they're able to physically.
If they physically do it, this is a good one for them to work on, right?
Yeah.
So that'll help get because again, when you're not moving, your brain starts shutting down, you're stressed, you're anxious. It's a slippery slope we don't want to get on. So
no, that's it.
Awesome.
All right.
So
sounds good.
Follow us on Facebook, Instagram, YouTube.
Yeah.
Check us out, www.crosscow.ca. Awesome. Thank you, everybody.
Awesome.
See you next week.
See you next time.
Have a great lollipop, kids.
Bye. Love you guys.